Session on myopia, a closer review. So we'll kickstart with Dr. Mallika Harikrishnan speaking on an overview of the myopia pandemic.
Good morning, one and all. Thank you, Dr. Samyukta and KSOS for this opportunity. We all remember the spirit, outbreak of a lockdown. It was a pandemic. Children were forced to stay indoor and attend online classes. Parents working at home, forced to hand over the digital devices even to the infants. Overindulgence and dependence on youngsters, often youngsters on digital gadgets. And what did it result? There was increased incidence of myopia and increased progression of already existing myopia. But even before this pandemic, the tendency was seen in many of the countries like Taiwan, Japan, Singapore, etc. The study shows that the prevalence of myopia exceeds 80% in some regions of East Asia, and there is 2 times higher prevalence of myopia in these countries than in Caucasians of similar age. What do they think as the cause for this high pressure education system? That is why I am here to talk about an overview of myopic pandemic. It won't be an exaggeration if I say that any other pandemic is, one more pandemic is being faced by the new world. One of the staggering trends in ophthalmic care has been the rapid rise in the myopia. So where do we stand? There is rapid rise in myopia which is associated with several pathological changes leading to irreversible vision loss. The prevalence of myopia in young adults in urban areas in East Asia is 80 to 90%, and that of high myopia is 20%. This is a graph showing the number of people estimated to have myopia and high myopia for each decade for 2000 to 2050. It is quite alarming, no? There is rapid global rise in the myopia, and the prevalence of myopia exceeds 28% globally. And the projection is that there will be approximately half of the world's population, or 5 billion people, will have some degree of myopia by 2050. Not only that, 10% of the world will have high myopia, 2-fold increase in the myopia prevalence. Number of people with vision loss resulting from high myopia would increase 7-fold from 2000 to 2050. What is the scenario in India? The prevalence of myopia among Indian urban children is predicted to increase from 20% to about 48% by 2050. 5 out of 10 children living in urban regions of India are likely to have myopia by 2050 if anti-myopia measures are not initiated. 2 out of 10 children in India are known to have rapid myopia progression, and the myopia progression is rapid in children who develop myopia at a younger age, and about 4% of Indian myopes tend to have complications that can lead to permanent vision loss. So more than just the need for spectacle correction in these people, chronic pathological changes are likely to happen in these children, like retinal detachment, myopic macular degeneration, glaucoma, amblyopia, and early onset cataract. So what are the causes of this myopization instead of emetropization? The proposed causes are genetic factors, environmental factors, accommodative factors, peripheral retinal hyperopic defocus. These will be dealt in detail by the subsequent speakers. Among the genetic factors, I would like to say that there is increased risk of myopia in children having 1 myopic parent, odds ratio being 1.87, and 2 myopic parents, odds ratio 2.40. animal studies suggest that the importance of environmental factors, that ultraviolet light may inhibit axial elongation by stabilizing the sclera. So spending 76 minutes a day outdoors result in 50% increased incidence reduction of myopia when compared to control eyes. The odds of myopia increase 2% for every 1 diopter hour more near work performed at each week. What is meant by this peripheral retinal hyperopic focus? Hyperopic defocus in the mid-peripheral retina driven by negative lens-induced myopia in turn leads to posterior scleral remodeling, choroidal thinning and eye lengthening. Is there any solution to these? Preventive therapy for myopia progression currently has 3 aims. 1. To screen patients with high risk of progression. 2. To stabilize the myopic progression. 3. To provide optical correction for healthy visual development. An increased emphasis on slowing myopic progression with effective childhood screening has been adopted by children in the primary care for children by the clinicians in primary care, pediatrics and ophthalmology. These are 2 hours of outdoor time activity, minimize digital screen time, and examine eyes early in one or more parents are myopic. And children should have minimum 9 hours of sleep and adults should have minimum 7 to 8 hours of sleep. So there are other armamentarium in our hands like low dose atropine, orthokeratology lenses and contact lens like multifocal, aspheric and bifocal. So to conclude, myopia is a common cause of vision loss, and with uncorrected myopia, the leading cause of distance vision impairment globally. The treatment for preventing myopia progression is reliant on effective screening and initiating treatment early in life, and there are implications for planning comprehensive eye care services and multifaceted myopia control system to buffer this scenario. Thank you so much.
Thank you, Dr. Mallika, for the detailed overview. Next, I invite Dr. Samyukta for her talk on understanding the pathomechanisms of myopia.